Eryped 400, also known as erythromycin, is a type of antibiotic used to treat various bacterial infections and to prevent certain bacterial infections. It belongs to the macrolide class of antibiotics and works by stopping the growth of bacteria. It's important to note that erythromycin only treats or prevents bacterial infections and will not work for viral infections such as the common cold or flu. It's crucial to use antibiotics only when necessary, as using them when not needed can cause them to not work for future infections. The recommended daily dosage of Eryped 400 will vary depending on the severity of the infection and should be determined by a healthcare professional. It's typically taken on an empty stomach, at least 1 hour before or 2 hours after a meal, and with a full glass of water. It's important to take Eryped 400 exactly as prescribed and to finish the entire course of treatment, even if symptoms improve before the medication is gone. This will help prevent the bacteria from becoming resistant to the antibiotic. If you have any questions or concerns about taking Eryped 400, be sure to consult with your healthcare provider for guidance. When taking Eryped 400, it's important to follow your doctor's instructions. You can take it with or without food, but if you experience nausea, taking it with food or milk may help reduce this side effect. Make sure to shake the bottle well before each dose and use a special measuring device/spoon to carefully measure the dose. Do not use a household spoon as it may not give you the correct dose. The dosage and length of treatment will depend on your medical condition and how you respond to the treatment. For children, the dosage is also based on their age and weight. To get the best results, take this antibiotic at evenly spaced times. Try to take it at the same times every day to help you remember. If you're using this medication to treat an infection, continue taking it until the full prescribed amount is finished, even if your symptoms improve. Stopping the medication too early may cause the infection to return. If your condition persists or worsens, be sure to inform your doctor. If you're taking this medication to prevent certain bacterial infections, be sure to follow your doctor's instructions exactly and do not stop taking the medication without their approval. Some common side effects of Eryped 400 include nausea, vomiting, diarrhea, stomach pain, and loss of appetite. Taking this medication with food may help reduce these symptoms. If any of these effects persist or worsen, contact your doctor or pharmacist. It's important to remember that your doctor prescribed this medication because they believe the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. However, it's crucial to seek medical attention if you experience signs of liver disease, unusual tiredness, muscle weakness, trouble speaking, blurred vision, drooping eyelids, or hearing loss. Additionally, seek immediate medical help if you experience severe dizziness, fainting, or a fast/irregular heartbeat. In rare cases, this medication may cause a severe intestinal condition due to a bacteria called C. difficile. Contact your doctor immediately if you develop persistent diarrhea, abdominal pain, or blood/mucus in your stool. Prolonged or repeated use of this medication may lead to oral thrush or a new yeast infection. Contact your doctor if you notice white patches in your mouth, a change in vaginal discharge, or any other new symptoms. Although rare, a serious allergic reaction to this drug is possible. Seek immediate medical help if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Eryped 400, make sure to tell your doctor or pharmacist if you are allergic to erythromycin or other macrolide antibiotics. Also, let them know about your medical history, especially if you have kidney disease, liver disease, or a certain type of muscle disease called myasthenia gravis. Eryped 400 may cause a condition that affects the heart rhythm, so it's important to notify your doctor if you have any heart problems, low levels of potassium or magnesium in the blood, or if you are taking other drugs that may affect the heart rhythm. Talk to your doctor about using Eryped 400 safely if you have any of these conditions. This medication may also affect the effectiveness of live bacterial vaccines, so be sure to inform your healthcare professional if you are using Eryped 400 before getting any immunizations or vaccinations. If you are on a salt-restricted diet or have a condition that could be worsened by an increase in salt intake, talk to your doctor or pharmacist because some Eryped 400 products may contain sodium. It's important to note that older adults may be more sensitive to the side effects of this drug, especially hearing loss and heart rhythm problems. If you have a baby, be aware that they may be at a higher risk for a certain serious stomach problem while taking this medication, so contact your child's doctor if your baby vomits or becomes irritable with feeding. Lastly, be sure to inform your doctor if you are pregnant or planning to breastfeed before using Eryped 400. It's important to be aware of potential drug interactions with Eryped 400, as they can change how the medication works and increase the risk of serious side effects. One known interaction is with the drug digoxin. Additionally, other medications can affect the heart rhythm when taken with erythromycin, such as amiodarone, dofetilide, and others. It's also important to note that erythromycin can slow down the removal of other drugs from your body, which may affect how they work. This includes medications such as certain benzodiazepines, erectile dysfunction drugs, and statin drugs. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Also, be sure to inform them before starting, stopping, or changing the dosage of any medicines. Lastly, this medication may interfere with certain lab tests, so be sure that lab personnel and your doctors are aware that you are taking Eryped 400. If someone has taken too much Eryped 400 and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222. If you're in Canada, you can contact a provincial poison control center for assistance. It's important to remember that Eryped 400 is prescribed specifically for your current condition and should not be shared with others. It's also crucial to follow your doctor's instructions and not use this medication for a different infection unless advised to do so. If you forget to take a dose of Eryped 400, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Do not take a double dose to make up for the missed one. When it comes to storing Eryped 400, it's important to follow the specific instructions on the product package or ask your pharmacist for guidance. Make sure not to freeze or store it in the bathroom, and always keep medications out of reach of children and pets. When it comes to disposing of Eryped 400, it's important to do so properly. Do not flush it down the toilet or pour it into a drain unless instructed to do so. It's best to consult with your pharmacist or local waste disposal company for the proper way to discard this medication when it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.